gotta do episiotomy.
So he's saying that he's gonna have to do episiotomy.
Why? We haven't even tried.
Listen here, you're pushing baby's head come down and doesn't come out because there is no space here. Okay? Baby's head is about that big. Your vagina is only that much.
Kimberly, no puede estar jugando ya. Tiene que salir.
What do you try? You're trying all the time. It doesn't come out. And if it comes out, it's going to rip apart the whole damn thing.
There's a few things that I want to talk about in this video. Firstly, how informed consent works. Does not work like that. Saying I'm just going to or I'm gonna have to is not informed consent. That is not consent at all, actually. I actually do understand why this doctor might cut an episiotomy. However, there's things that you can do before an episiotomy needs to be introduced. Seeing your baby go out and then come back in with every push can be normal in some circumstances, but a lot of times that can be a shoulder dystocia on the horizon. They call it turtling. However, an episiotomy is not the first thing that you turn to when you want to try and avoid a shoulder dystocia. Obviously you can't see much, but I can tell that this patient is in supine position, so on their back. If you know anything about birth, you know that being on your back is probably one of the worst positions that you could possibly be in. When you are in supine position, that opening becomes more closed because of the way that you are laying. And let me tell you, even if you have a working epidural, there are so many different positions that you can be in besides on your back. They could turn you on your side, which is just super freaking easy, especially if you were in supine position. They can get you in a supported squat, trying to help open that pelvis. Getting into different positions helps that baby to be able to descend properly. Also, it sounds like there is a complete lack of communication here. This doctor is only explaining it as the baby is coming in and out, which can also be normal, but you're not explaining why that's a bad thing or why there might need to be an episiotomy done. Communication could save so many people from going through birth trauma. Communicate. It takes 30 seconds.